Good afternoon, everybody. It is May the 22nd. Alan Harris here in the Emergency Operations Center, giving an update on COVID-19 in our community and the response to that event. And today we will also be discussing the upcoming hurricane season and some of our hurricane season plans as we get closer to the season. Ironically, already a named storm, Arthur, was passed us by over the last week. So we already have a named event here. Of course, we don't want to think about hurricanes. We've been thinking plenty about disasters related to pandemics, but we, of course, in emergency management have to plan for those types of things. So let me give you a real quick update on COVID-19. To date, we have 451 positive confirmed cases since the event started. So since we had the first case, 451 here in Seminole County. The state of Florida is reporting back. So testing here in the county that we have received test back is 17,133. So 17,133 people, we've received their test back. Of those, 2.6 individuals have been tested positive. So of course that's been down. That's down quite a bit from a few weeks ago, about 3 weeks ago now, when it was about 10%. And that is, we were anticipating that. That is, of course, due to the fact that our pop-up sites and our testing sites now are testing anyone that is interested in getting a test. You do not have to have symptoms to get a test now. So if you feel well and you want to get a test, you can get a test at one of the pop-up sites here in the county. We stand still at 12 fatalities, so we have not had any additional fatalities in the last week. We're very happy about that. Very, of course, upset that we did have the 12, one being a couple, and that's, of course, very tragic to that family. So we wish them well during their grieving process, and certainly we want to prevent any more deaths in our community. Currently, 3 patients are hospitalized. Seminole County residents are hospitalized, so that's down a little bit as well, even from last week. So last week when I was talking to you, it was about 5, and we've gone down just a little bit to 3. So that's excellent news. So overall, we're continuing to see a trend downward. We have had a few little bumps in some positive cases coming back in, but overall, it looks like we continue to be on that flattening, no additional cases. So that's good news. We have testing, of course, this week. So this weekend we will be testing. We want to thank the American Muslim Clinic, Bueno Pharmacy, and the Florida Department of Health. They'll be partnering to conduct a pop-up test site at the St. Mary Magdalene Church. It is important that individuals bring photo IDs with you, as well as your medical insurance. So if you can bring your medical insurance card, if you have it. If you do not have medical insurance, you are still welcome to come to that event, and we will work with you. The event is from 10 a.m. to 2 p.m. Again, St. Mary Magdalene Church in Altamont Springs. It's right off of Maitland Avenue. Following Saturday, we will be doing an event at the Orlando Kennel Club that is on Dog Track Road, not too far actually from St. Mary Magdalene in Longwood. And yesterday, of course, we did the pop-up site at Jackson Heights in Oviedo. We may do a pop-up site next week at some point. We're working with the Department of Health and True Health to see if we can identify a location where we would open up a pop-up site. And that, again, will be more of like a neighborhood-based site. Antibody testing is still available here in the county. So we have antibody testing right now, one blood for all blood donations. So if you donate blood with one blood, they will automatically do an antibody test for you. So you get that free as part of your blood donation. And the results generally come back within 2 to 4 days. So once you've given the blood, in about 2 to 4 days, expect a phone call back from them, and they will give you information if you have the antibodies for COVID-19. You can visit oneblood.org, again, oneblood.org, to schedule an appointment there. Let's see. There are other places that you can get antibody testing. Those locations are Urgent Care of Longwood, Stages of Life Medical Institute, LabCorp and Quest. And for LabCorp and Quest, you would need a prescription from your doctor. If you don't have a doctor, like I've said in a couple of the other Facebook Lives, they have doctors, like telemedicine type doctors, so they can write a prescription directly there from LabCorp. So just give them a call prior to, and they will help you. The Public Information Team and Economic Development Team launched a consumer confidence survey to gauge how comfortable residents were. We had over 700 consumers respond to that survey. The survey results are available at prepareseminole.org. Again, if you go to prepareseminole.org, you can see those results. Last week, we had a meeting with all of our faith-based leaders. We had about 45 faith-based leaders meet with us on the phone. We're doing another one again this week, this coming up Thursday at 1 p.m. And we're real excited about that. Very great conversations last Wednesday with our faith leaders, and look to have the same wonderful conversations this Thursday as we work with them to discuss reopening plans. We had some great best practices from some faith organizations. They provided some great input into how they're reopening and some of their reopening plans, as well as some very innovative ways that they've been reaching to their congregations over the last week or two, or 3 or 4 in this case. So we'll continue that. If you'd like to participate in that, go to prepareseminole.org, and there is a click there. There's a link there for the Eventbrite schedule. Just click on that and register that you would like to come to the faith leaders discussion and presentation on Thursday, May the 28th. Again, it's at 1 p.m. Also on the COVID side, well, let me go to the other side. So completely unrelated to COVID-19, during this event and over the last week, we have been very, very close to what we call a KDBI, the drought index that we monitor very, very closely. The KDBI index, once we get to an index of 500, so that means that the fuel, the wood, the debris is dry enough, and the relative humidity is low enough where we start to see wildfire be a very big threat. So we did reach KDBI index of over 500 last week. So due to that, we issued a burn ban. The burn ban is for outdoor burning, bonfires, campfires, and burning of vegetation. Yard debris is not allowed at this time. You can't, individuals, if you do have fireworks, are encouraged not to use fireworks at this time due to this burn ban. If you have an above ground charcoal or gas or electric grill, you can use that. We ask that if you use that, of course, making sure that the charcoal is very well out before you leave the grill area. And of course, we encourage you just to be very, very safe during this time. If you smoke, do not throw cigarettes out of your car. In the past, of course, those have started small wildfires on the side of roads and things like that. So everything is just very dry. I think that you live here in Seminole County, you know that that's the case. So we want everybody to be safe, especially this weekend, as individuals may have holidays on Monday, maybe have some days off this week, some extra days off. We certainly want people to be safe as they picnic or barbecue or however they celebrate this particular holiday. Memorial Day. So since I was talking about it already, Memorial Day Remembrance Ceremony occurred this morning at 3 p.m. This morning at 9 a.m., right? Yeah, it was 9 a.m. All my times today has been crazy, but all my times are off today. But at 9 a.m. and that'll be broadcast again on SGTV. So if you tune in to channel 498 on SGTV, it's going to be rebroadcasted at 3 p.m. I'm sorry there was a little bit of if you were watching here on the Facebook, there was a little bit of an audio issue. We apologize about that, but that's all been fixed. So at 3 o'clock, you're going to hear the whole ceremony. We want to thank those friends and family members of those that have given the ultimate sacrifice in the protection of our country. Those firefighters, police officers, and military personnel. There's not enough thanks for you as family members and friends during this time of remembrance. So we just want to thank you. Our hearts with you, and that's it. So. Youth sports. So the governor did announce this morning that it's safe for youth sports to resume. We had already started the process in leisure services, our leisure services department, discussing when sports activities would take place. We were looking at around June 15th. That is still on this, the timeline for us. As the governor mentioned, they want to make sure that everything is safe as we start to plan this, and we are doing that. So we want to make sure that before we open up the dugouts and things like that, that there is the proper cleaners, hand sanitizers, things like that that would be necessary as individuals interact. So we want to make sure that the concession stands, of course, are cleaned regularly, any of the bathrooms, things like that. There's a lot of different things that go on to doing those types of activities. So the time frame at this particular moment is June the 15th. We will certainly update you as it gets closer. Let me get to a few questions. Let's see. Hello, everyone. Hey, Joan. Hey, Dana. Colin. How are you doing? Abraham, how's it going? It was good to talk to you, or email back and forth with you earlier. Well, it was about 3 or 4 weeks ago, I know. Can we please? So Pamela asked, can we please give local government time to figure out when? Thank you, Pamela. Yes, we are trying to work on it as best we can, Pamela, and those playgrounds, the youth sports, as I said. So we want to make sure when we open, of course, we open it safely. So we already have tried to get the hand sanitizing stations and things like that for our dugouts and such. Right now, one of the main focuses here in the EOC is to try to get the courthouses open by June the 1st. We have ordered hand sanitizers and things like that. They were about a 2-month delay. We're hoping that they come in as they said they were about a month ago when we ordered them, and that will be next week. So if they do come in by next week, we will be able to open on June 1st, and everything looks like that's a go. Of course, we ordered the hand sanitizers for the dugouts and things like that. That was a lesser of a priority for the vendor. So they are trying to get it to us, and hopefully we will get it in time, and then we can, of course, open those types of things up as well. Melissa asked, can bars open? That's a phase 2 type of event. So right now we aren't in phase 2 based on what the governor has said. So if we do get to phase 2, we certainly will open those types of things. We will, support, of course, any openings of those types of things. There's nothing in our ordinances, Seminole County's ordinances, that says that a bar can't open up, but we can't trump the state of Florida. The state of Florida's executive order says that they can't. So at this particular point, they cannot. Now, if a restaurant or restaurant/bar that brings in over 50% of their revenue from food, the governor did say that those would be okay to open up. Going back to you, Abraham, I think I already answered this, but the youth activities and things like that, playgrounds, yes, we're working on the reopening plans for all of those things. We are very familiar with all the CDC guidance. We get that all the time. Literally every time they push out guidance, we get it and we read it. And certainly we did get the comment about that it's lesser, it wasn't totally out, but lesser concerns for the surfaces and things like that. But we're still going to clean the dugouts in between each of the playground, the events, and each time the sporting events. So out of an abundance of caution. I know that they have said that it's less of a concern, but they didn't say it was absolutely no concern whatsoever. So we're going to make sure that our youth and we're going to make sure that our families are safe here in the county. Cindy asked, will there be a supply shortage for hurricane supplies? I hope not, Cindy. I hope that we don't have a massive rush out for that. The sales tax holiday, just for anyone that is interested in buying some hurricane supplies, The sales tax holiday is May the 29th through the June the 1st, May the 29th through June 1st, so that's next week. So certainly we are, if you're interested in getting prepared for the hurricane season. So since we're also are talking about hurricane season, let me talk to you a little bit about the hurricane season. Our sheltering is going to be, actually, hang on one second. Can you print me the shelter plan? This is the EOC plan. But I'll talk about so the EOC here in the Emergency Operations Center, there's normally about 114 individuals that work in this facility, and they come from all different organizations, FDOT, FHP, FDLE, all the acronyms, Duke, FPL, the water utilities, public works, environmental, water, sewer, solid waste, garbage, the landfill, you name it. They're all in this room. So we have to, if we're going to do social distancing, which we are, we have to go from 114 people down to 34 people. So that's just in the Emergency Operations Center. So that's one of our tasks here in the EOC is how we're going to do that. So we've been working on that plan. We've also been working on the shelter plan. So as part of the shelter plan, there's a couple different phases. So the sheltering is going to look very different. In fact, we're not even really going to call it sheltering this year. We're going to call it thank you so much. We're going to call it the refuge of last resort. This is the last option if you don't have any other options. So the first thing we want to encourage people to do is to, if you can, if you're able to, maybe you're retired or something like that. If you're retired and you're able to evacuate early to get out of the way and not get stuck in that traffic, that may be your first option. The second option is if you have a concrete masonry block home, it may be safe to be inside of that home. Just know what year the home was built. Know if you've had your roof repaired, things like that. That's if you have a new roof, your construction is good. It meets the Miami-Dade construction new building code, then it should sustain, at least a category 1, 2, or 3 hurricane. If your home, if you said, hey, my home is not safe, I need to get out of my home, it is better to go to a friend or a family member's home with a concrete masonry block home, other than to go to an emergency shelter or a refuge now of last resort. A refuge of last resort is what we're going to call it. If you cannot do that, consider maybe evacuating to a hotel or motel. Of course, those are concrete masonry block structures, so that would be your option 4. If for some reason none of those work, then you can, of course, seek the refuge of last resort. And the refuge of last resort being an emergency, what we used to call an emergency shelter. Inside of the emergency shelter, our capacities are going to be dramatically decreased. So where we would put about 1,000 to 2,000 people in a high school, we can't do that anymore. We can only put about 500. So there's going to be very limited space inside of the shelters. As part of the evacuation process, when you call to make a reservation to get evacuated, you will be asked some questions. You will be asked about your travel history, things like that. And what it does is it'll determine which emergency shelter you're going to go to. And if you don't need transportation, of course, you can just drive to the closest shelter, whatever the closest shelter is to you. If you do need transportation, we'll ask you some of those questions. Once the bus gets to your location, each of the members of your family will be temperature checked and before you're allowed to get onto the bus. Once you get on the bus, of course, go to the school. You'll be unloaded there at the bus stop, and you'll go right into the shelter. For those that don't need transportation assistance, then you can drive over to the emergency shelter. Before getting out of the car, the questionnaire will be sent to you, given to you, and you'll be asked some questions. Have what your travel history is, if you've been around anyone sick, things like that. Depending on what the answers are, and we'll also do a temperature check. As long as you meet those criteria, you'll be able to go into the shelter. And if you don't meet the criteria, then you'll be going to another shelter. And that shelter will allow for a little bit more isolation of individual family units to make sure that people are more spread out, and that if for some reason COVID does get in there, that there is unlikely to spread. It's very different than we've ever done anything before. So I want you to know we've done a lot of work with the Seminole County Public Schools bus transportation system, Seminole County Public Schools, the Sheriff's Office. There will obviously be a stronger law enforcement presence inside of the emergency shelters. There will also be, of course, a stronger medical presence inside of the emergency shelters. We're still working on some of those types of issues. So there aren't going to be the creature comforts that we have. I mean, even before, there weren't a lot of creature comforts in an emergency shelter, but there's going to be less this time because staffing is going to be limited, because we want to limit the amount of staff that will be in the congregate type of environment with lots of other people. So that's going to be a concern. So staffing, a little more law enforcement presence, though, and more medical presence. Inside the shelter dormitory, it's important to know when you come to an emergency shelter or a refuge of last resort, you're given a place on the floor. So it's important to bring your sleeping bag. If you have a cot, bring the cot, any personal type of items, things like that. When you go through the registration process, you'll be given a color band. The color band will let you know when your feeding time is. So we're not going to have everybody go to get food at the exact same time like we've done in the past. There'll be separate time frames for each individual group to go and get food. That will limit the exposure of people to people. So that's just real important. In between the area, so each individual gets around 21 feet. So that's 7 feet by 3 feet. So in between each area will be 6 feet. Now, family units, of course, can stay together, but between the family units and between individual persons, if you aren't in a family unit, will be about 6 feet distance. So as you can see, shelters that used to have people, and you've seen pictures of them if you haven't ever been to an emergency shelter, where they're side by side by side, that will not take place this year. We will have a lot more social distancing and things like that. This is all out the window if we find a vaccine. So of course, if there's a vaccine found and everything gets better, then of course we'll go back to sheltering the way it was. But we have to plan for this. So this is the way we're planning, and so that's what it's going to look like this year. Let's see. Let me see. Kenneth asked about the ballparks. Again, Kenneth, we're working on the ballparks. I think it looks like there's a lot of similar questions. Kenneth, yeah, can teams practice? Again, we're trying to open those as soon as possible. I have a call this afternoon. So we have a call this afternoon specifically with our Leisure Services Department. We have finalized the reopening plan. And some of the equipment that we're going to need to make sure that the dugouts, the meeting areas, the bathrooms, the concession stands, all those types of places get cleaned. Valerie asked about the pop-up sites and the times. Valerie, if you go to prepareseminole.org, at the very top, you can click on that and you can get all types of information on the pop-up sites. Michelle asked you about the playgrounds. Again, the playground, same thing as the baseball and the softball and the soccer. We're making sure that those are as clean as possible. And then we will be planning the reopening of those as well. So soon, you certainly will be. It'll be on Facebook and other places when the playgrounds will open, and you can bring your children right back, as the governor said. Get those youth all back together, and if that's what you want to do. If you don't want to do that, it's. Every one of these things is a personal decision. So you got to make those personal decisions, whatever those personal decisions are. Abraham asked again about the basketball courts and the water. Well, we don't have water slides.
Well, the HOAs.
HOAs. I'm sorry. We do not stop any HOAs. So HOAs can open up right this second. There's no executive order, Abraham, that says anything about an HOA. They can open their pools. They can open up we don't say anything about it. So they can do whatever they want right this second. We have no executive order that talks about HOAs at all. In fact, someone called me the other day and said, "Hey, Alan, are your pools open?" I think I even told y'all this. And I said, "Yep, all of Seminole County government pools are wide open." That would be Lake Monroe, Lake Jessup, and Lake Harney. We don't own any pools. Seminole County government owns 0 pools. So if you want to open up your pool, then you can open up your pool. We don't, and this is real important because people call us and they say, "Hey, open up Lyman High School pool." Well, that's the school board. That's not Seminole County government. So that's a different entity. You need to contact them. We don't run the cities. The cities are completely independent. So I cannot tell Altamont Springs that you need to open up a pool. I can't tell the city of Sanford you need to open up your pool. That is their decision. It's their pool. It's their park. It's their playground. So every city is going to be slightly different. Every jurisdiction is going to have to make a different type of choice. You all have seen our dashboard. So if you look at our dashboard, you may have one city that has a hot spot, and they may make a decision that's different than another city that doesn't. So they are getting the same information that we have. So they're going to make those decisions based on medical doctors' opinions, the spread of the virus in their community, things like that. So the same thing for the school board. They're going to make their decisions based on, can they clean it? Do they have the staffing to clean it? Those types of things. Do they have the materials to clean it in some cases? So Michael asks, stress and mental health due to restrictions. When will we be allowed to resume normal activities? Since day one, we have said go out and enjoy one of our wonderful trails, bike on one of our bike trails. We have lots of nature parks. We have probably the most beautiful areas out by the Yarborough Center. There's beautiful lakes and walkways and things like that. We have a wonderful riverfront now. You can just walk along the riverfront there, along Lake Monroe. It's just very peaceful, and see the swans and the birds flying around. So if you're trapped inside of if you feel like you need to be trapped inside of your home, please don't feel that way. Since day one, Chairman Zimbauer and myself, we've all said that parks will remain open, and they have remained open. And we want you to be able to go out and experience, as good of life as you can. And we understand that. There are so if you are feeling challenged in this way, I am very, I developed a mental health plan for hurricanes because I saw a need back in Hurricane Matthew. We were one of the first in the state of Florida to develop a mental health plan strictly for our shelters. 3 years later, the state of Florida actually hired a mental health individual to deal with emergency shelters mental health. And that was after Hurricane Michael, but we had ours already written. And it's important for me. I just feel it is. And it is important for a lot of other people too. So if you are feeling that you may need some additional assistance, there are mental health resources that are available on our website. And we specifically put that because we know that, that may be the case. So just know that. We have been working with the Zen Dog Network. The Zen Dog Network is a wonderful organization that goes to ALS and nursing homes. So the dogs go, and they can't go inside, but they can go to the windows. And the reports we've heard back from the nurses and the other the folks that work inside of the ALFs and nursing homes is pretty remarkable. So we are very, very happy that we've been able to at least to do that. The last thing I would say is, if you do have someone in an ALF or nursing home, we know that right now there's some restrictions in getting in there, but there's no restrictions in making phone calls. There's no restrictions in Zooming or doing one of those other types of things to talk to the folks. So just note that. Michelle asked, will the county offer antibody testing? We have really tried with our nonprofit organizations, and we are reliant on them to be able to do that. And at this point, we've also asked for antibody tests from the state of Florida. They have not been able to provide that to us, and neither has the nonprofit organization at this particular point. They are wonderful people. I am not saying anything negative. In fact, they have done just amazing work in our community. But unfortunately, the lab has not gotten the authorization, and we have not received the antibody test yet from the state of Florida. We continue to make that request. We were hoping they would come in 2 weeks ago. They did not. We were hoping they would come in last week. They did not. We were hoping they would come in this week. They did not. So we are continuing to make that request, and we will do so. I am now at 12:30. I want to wish y'all a wonderful weekend. Again, to the family and friends of those that have given the ultimate sacrifice. God bless you. God bless your family. God bless your friends. And thank you for being with me today. I hope you all have a wonderful weekend. God bless everybody.